Hello, we're going to talk about drain care. And Crystal has had a tummy tuck, and when we put drains in, we put the drains in underneath the wound so they don't collect any blood or fluid, and then the patient will typically heal faster without a gathering of all the fluids. So when we have a drain, we have the drain tube, and then we have a bulb. And we are actually wanting the fluid to come from the tummy or wherever the drain is through the tube into the bulb so it will drain that fluid. When we're trying to do wound care, we want to keep the area clean. You can always put a little bit of antibiotic ointment on it, but just keep it dry and clean. We do have it sewn into place so it doesn't pull out with a little suture. When we're taking care of the drains, we like to strip the drains, and you may want to strip the drains every couple hours while you're awake. And when we strip the drains, what we do is we hold on to the drain, and then we take our other finger and thumb and just squeeze and come down. And then we bring the fingers down and squeeze and come down. So what it's doing is suctioning fluid from the abdomen or the area that the drain is in into the bulb. It also keeps the drain tube open so it doesn't become clotted and stop up. And so we want the fluid to come into here. Now, you may not have very much fluid, but initially, typically you will have a lot of fluid, and then as the days go on, you'll have less and less fluid. When we're trying to record the amount, we typically will give the patient a drain sheet. It tells you the date, which drains, and how much you have whenever you're emptying it. So to empty the drain, you take the drain and you take the top off, and basically it lets the suction off, and then you just take this drain, let me just get it up real quick, and we empty the fluid into this cup, okay? And then you can measure the amount that's in there and then write it on the drain sheet. And this will help the nurse to calculate this over a 24-hour period, and then we can decide when to take the drain out. Typically, we will always want the drain tube to be collapsed like this so it will suction the fluid into the drain tube or in the bulb. If it's not collapsed, it's not working, so it's not taking any fluid out of the wound, okay? So basically that's how we take care of the drains, and what we want to do after the post-op care to keep the drain tube open, and also to make sure we get all the fluid out so that you'll heal faster, okay?